So she's come in, we're gonna drop the tray, gloves off, and then we're gonna hand hygiene, and we're going back to the room. She's gonna put on new exam gloves, then her utility gloves, because now we need to clean and disinfect our room. So in order to do that, we're gonna have to use the chemical, so we need to have the utility gloves on. Now she's gonna grab her wipes, 2 wipes, and she's gonna wipe those surfaces. So same thing like we did first thing in the morning, but now we have to wipe it all again because we worked on a patient. So overlapping strokes, she's wiping everything, always staying on the wipes. She's gonna get that handle, perfect, go to her hoses. She's wiping those hoses, holding with one, wiping with the other, making sure she wipes the whole. Perfect. So this bar over here, we have to wipe everything, regardless if we used it or not, because there was no plastic covering. There was no barrier covering. And if we put those down and next to them, then we can contaminate the other ones. So you have to wipe all of them if they're not covered by a barrier. So remember, if something is covered by a barrier and the barrier does not get broken, it does not have to be wiped. So when we come here, we don't have to wipe this area here because we had the barrier. But we have to come over here and wipe the air water, right? Because your tray table was covered with a barrier. You don't have to wipe that. Good. And then the high speed. Everything else here we don't have to wipe because it had a barrier. And then we need to wipe the doctor chair and the handles. Wiping that. And then on our patient chair, we don't have to wipe the headrest. We just have to wipe about halfway down where our barrier didn't cover. There we go. And then the arms and everything else. All right, so that's her first wipe. So that wipe removed debris. So she's gonna toss those wipes, grab 2 more, because the first wipe is removing debris. The second wipe is actually disinfecting the surface. So we have to make sure that the surface is clean before we can disinfect it. So she's doing the exact same thing. Now this motion is just kind of a singular motion. You don't have to scrub very much. You're just getting the chemical. The first time she really scrubbed it to make sure there was no debris on there. So this is kind of a faster wipe, if you will. Just getting that chemical on those surfaces. Remember, doing all of the assistant bar. Do not have to do the table because we had a barrier. Then we only have to do the air water and the high-speed handpiece on this side because we had a barrier on everything else. Then the doctor chair. And then we're going to move to the patient chair halfway down the backrest, the arms, and the seat. And then when she finishes wiping those wipes, she's going to use on her gloves to make sure that those are nice and clean. And then one more wipe to disinfect them. So this process has to be a pretty quick process of rotating those rooms because there's going to be a patient waiting to come in. Perfect. And now your gloves are cleaned. Good job.